Hello and welcome to another episode of Everything Digital Health. I'm Marcus Bohr. I'm a GP and clinical informatician and software developer. Today, my guest is Tony Shannon, who is someone who was a familiar face in the IT community in the NHS when I started in NHS IT. But since then, he's gone back home to Ireland and is now working for the office of the Government CIO. So welcome, Tony. And perhaps if you can introduce yourself, tell us a little bit about your background and how you got to doing what you're doing.
Yeah, great. Thanks very much, Marcus, for the invite to be here. We obviously spend quite a lot of time working together in the NHS, and I guess just to give a brief background on myself, medical graduate in Dublin, went off to the northeast of England to train in emergency medicine. As part of my training, I took an interest in informatics, which we'll talk about, and I did a fellowship in the States, came back to finish my training, did a master's in IT management because I was interested in the subject up in Sunderland. And then I ended up working for the National Programme for IT for 5 years down in Leeds, where I was also started as a consultant in emergency medicine. Went from there to a CCIO role in Leeds Hospitals and Leeds City, doing stuff like the Leeds Care Record. And then from there began to make a move beyond that. I set up a non-profit called the Ripple Foundation, doing open source in healthcare. Moved back to Ireland around that time, and then just before the pandemic, I decided I had maybe wanted to change from the challenge around health and IT, and I was seeing patterns elsewhere, and I took an interest in government IT. And lo and behold, ended up finding myself in this job in head of digital services in the office of the Government CIO here in the Government of Ireland. So yeah, quite a few different phases to my career that brings me here today. Yeah.
Yeah, that's a really interesting set of backgrounds there, isn't it? So you're a medical graduate, you medical IT, and then gradually drifted into governmental IT as a whole kind of thing.
Yes.
And I suppose one of the most important questions I'd want to ask is, like, what are the differences that you've observed? What are the similarities between health and government?
Yeah, I think I keep talking to everybody about patterns that I see, in the complexity of the world we're in. And when I look at it now at health IT, I see, very similar patterns in healthcare, than I see in the rest of the public service and indeed more broadly. And indeed, that's kind of how I ended up making the transition. I talk a lot about, people issues and process issues and technology issues, that triad. And I keep talking, or there's a paper I came across in 2019 which talks about the whole of government investment in digital, which really was one of the things that helped me make the move, because what it made clear is that we are needing to move towards a different way of delivering healthcare. As you know, I mean, you and I would have talked before about the information dark ages that healthcare is in. The proprietary technologies that are part of the problem, the need for an open platform, the need for kind of a building blocks that kind of allow for a federated solution. The push I'm involved in now is what you might call digital public infrastructure for the 21st century, and I think that applies to healthcare just as much as government. So there's so much common ground, really. All I would say is that government and the public sector is fairly conservative by rest of industry standards, and the outlier in terms of being the most conservative and risk averse sector that I see is health. Very slow to change. And for obvious reasons, clinical safety, etc., gets parroted a lot. But I think it's why healthcare is in the place that it's in. It's just so far behind in general terms of the information age. That was my general observation when I was last looking at it some years ago, and certainly I think that that's still an ongoing issue in the sector as I see it.
I think that certainly resonates with me, that healthcare seems way behind. Um,
Mm.
Even though parts of healthcare were ahead, back in the 90s, general practice IT in the UK was kind of ahead of the curve in terms of computerization. But then I think
Mhm.
everything's gone to sleep as soon as the dead hand of government has got involved. And although now other parts
Mm.
of the UK government have sort of sprung ahead with things like gov.uk and
Yeah.
the government digital services team being quite forward thinking in terms of bringing the internet era cultures to how government technology is
Yeah.
built. They build everything in the open. We've got that brilliant government service standard, which
Right.
is
Right.
the same as
Yeah.
the kind of the NHS service standard.
Yeah. Yeah.
But then, like the healthcare, the way we actually deliver clinical systems is still just buy something in a box off the shelf from a USA mega suite kind of thing. And, they're all closed
Yeah.
platforms. They don't talk to each other. We can't build on them. We can't connect them.
Yeah, I mean, you obviously don't want to jump into the politics and the economics of these issues too soon. But I mean, I think if I look at, and I'm in Dublin now, by the way, but if I look back at the proud years I was in the UK, I lived there for 17 years, and I was there to witness, two things. Obviously, one was the world leading, institution that is the NHS. I still think it's the most noble healthcare system in the world, and so much good about it. And in parallel, the Gov UK GDS set up in 2011 or something around that time was world leading at the time in terms of its user centered design, agile development, open source push. It was very helpful to me when I was in Leeds making the case for open source in healthcare. GDS has had its challenges because of the size and scale of England, but it still would be seen, I think, as well up there in terms of the world leadership. But you never, some of us did try to help the NHS move towards that more user centered, agile, and open source approach, as you will well know. But yeah, the NHS hasn't fulfilled its potential because the alignment, if you like, of the NHS's values and the values, let's say, in GDS around agile, user-centered, and open source design just haven't been married up together. And yeah, you're seeing that's my understanding. I'm out of touch in many ways in the NHS now, but certainly I see, that was a problem then, and I believe it's still a problem now.
Yeah, I think there are pockets of excellence and adoption even within the NHS where
Mm.
those GDS principles have been brought into the NHS. The team I'm
Mm.
working in now, actually, I've just started working with a vaccinations platform team, and they're absolutely doing GDS principles 100%, and that's really
Good.
nice to
Yeah.
see.
Yeah. Yeah.
But
Yeah.
I think that's a drop in the ocean compared to the vast amounts of tech we have and the vast amounts of money that's spent on tech, and
Mhm.
it's the old story that we're just not getting the value for money that
Right.
we should be getting from
Right.
those amounts of cash. It's kind of
Mm.
freakish in a way, that when you look at the telephone number money that gets spent with Microsoft and Cerner and Epic and the big cornerstone companies, and
Right.
they don't seem to know how to get away from it. Um, on that note, would you like to tell us about the 1% campaign? Because that's something that you spearheaded. This is going back a bit now. I would say it's nearly 10 years ago, isn't it? But
Oh, it would be, yeah.
tell us
Yeah.
about that, where that came from, the idea.
Yeah, sure. Well, I mean, I'm again, I spent 5 years in National Program for IT, so I was fortunate to have that experience of seeing the NHS try to, transform with digital. And in some ways, it did make massive leaps, particularly in primary care, as I understand it. It advanced in the hospitals, it completely got stuck. But as you remember, they were spending 6 billion initially, went to 12 billion. So there's massive amount of money being spent on it. I was very frustrated within there about the proprietary nature of the technology, poor usability, poor interoperability. It just
Yeah.
represented very poor value for money as far as I could see. And I started making a push around that time. Again, thanks in part to the GDS model, but for user-centered, agile, and open source type of approaches. And I'm trying to remember, but I think it was probably around that time that I moved back out of the National Program for IT into Leeds and started clinically led, user centered and agile design with open source technology and innovating, if you like, and delivering from the bottom up, which did turn out to be very successful, very good value for money in terms of what we were delivering there. But again, I remember around that time there was another plan to spend more billions on the NHS IT. I think the figure was 4 billion being floated around at that time, which would probably be about. I don't want to get the dates wrong, but 2017 or something like that.
Sounds about right.
Need to check that. But anyway, I said, look, myself and the late Ewan Davis, who was a great ally and colleague at that time, said, there's got to be a better way to do this. And we were making the case that if you were to give 1% of that 4 billion for the 99%, because, there was real questions about how that money was going to be spent. Give us 40 million and let's see what we can do with it. And actually, I still have a copy. I thought I'd bring it today. The Aperta Open Platform paper. Oops, can you see that?
I think Teams is blurring it out for you, but
it is. It is. Let me get it. There it is.
There we go. Defining an open platform. I will almost certainly be able to find a link for that, so I'll put that in the show notes so people can get.
So anyway, I was involved with you and the Aperta people around that time for that push, which was basically just saying, let's try to find a way to build out an open platform for the NHS, which I think is still absolutely part of the same digital public infrastructure I've spoken about. So we said the idea was take 1% of the 4 billion, which would be 40 million, I think. Let's split that three ways. Let's suggest we'll end up, coming up with a fund to build out the building blocks that are required in healthcare, as they are here: digital identity, data collection, integration engines, data repositories, that kind of stuff. And put about, I think we suggested 18 million into that. Maybe a couple of million per building block. And then put another 20 million perhaps into exemplar projects, which would use those building blocks in action, to actually deliver at the front line. So you'd have building blocks plus implementation projects, and then a small 10% or something to kind of administer all that. So we put that idea out, and then invited people across. Indeed, I'm glad to say, all of the countries, England, Scotland, Wales, and Ireland, North and South, to bid into that. And we got, I think, quite a number of bids. We got many bids, totaling many, 20, 30, 40 million expressions of interest. And interestingly, we asked them, people, would they be willing to match the funding if they got the funding? And a lot of people were willing to match that funding. So we took that suggestion of a group of thought leaders who wanted to innovate, who build out this ecosystem, the building blocks, and get involved in implementation projects for the tune of 1%, and brought that idea to the NHS leadership at the time, and it didn't go anywhere. So that's as far as we got. But the principles of the 1% for the 99%, and that buzz term, if you like, has an economics ring about it. Still, that was an idea that seemed to be of interest to people at that time, and I've cited it quite a few times since. And it was an idea that had potential, I'm sure.
Absolutely, it's like an insurance policy, isn't it? If you've decided you're going to spend 4 billion, and there's nothing to some extent we can't do anything about the desire to spend telephone number money with megacorps, but if we can convince somebody that it's a good idea to have that insurance policy, then it was a good idea back then, and it would still be a good idea now. I mean, I remember around the time you were doing this, I was working on NHS Ubuntu with Rob Dyke, and we were again only asking for like the table scraps. We just needed a small amount of funding to get going. And then we would have turned that into something that was in itself financially sustainable, because you put a business model around an open source project so that it can remain open, and you have a foundation, and then you have some kind of commercialization of that. And then it all keeps itself going. And these open source business models are, that's what keeps Canonical going and Red Hat going in the Ubuntu world. And there are many examples like WordPress and Discourse. Exactly this. They can have an open source project and they can still make it wash its own face, as it were, in terms of financial reward. So with that little seed fund of the 1%, we could have absolutely transformed healthcare by now. If you imagine where we'd be if OpenGP SOC had been funded, if NHS Buntu had been funded, if Ripple
Well,
OSI had been funded.
well, indeed, indeed. I mean, what I think is interesting is, again, in the geopolitics of all this, Marcus, which is that, when you and I were involved in talking about open source at the beginning, when you and I met initially, gosh,
Yeah,
was it 10 or 15 years ago, we
around
might
then,
have been
yeah.
seen as kind of left wing, kind of, mad rebels type of thing. You look at what's happening now. In the last 10 years, you see a couple of issues, certainly on the tech side, the big tech side, all the big technical, the big tech, the big hyperscalers, as they call them, have got involved in open source in some way or another, and a lot of them in a big way. I mean, look at Google and Android, look at Microsoft and GitHub, for instance. Look at
Yeah,
Meta and Llama. And so big tech has adopted open source in a big way and and it has now become a norm. If you're looking at products being released, open source is the way to go.
yeah,
And then in the way the world has changed in the last 2 years or 3 or 4 years, also very interesting. If we talk about AI at all, and you talk about large language models, guess what's happening with large language models? They're now being released in open source by the Chinese in major volume, and it's
yeah,
completely changing the nature of AI development, becoming again the de facto norm, which is a big geopolitical issue. And then in the middle, in terms of Europe, if I can talk about, digital and data sovereignty concerns that Europe has,
yeah,
in terms of its concern, which is a very live topic for a lot of us at the moment. Again, big push towards open source. So, what was once a
yeah.
fringe activity is not such a fringe activity anymore.
I think
And
that,
as you and I know, because of our background as medics, the case, of course, has always been there, not just on ethical grounds for this, when you're investing in digital infrastructure for the public, but on scientific grounds. Publish your code in the open, in the same way you publish in a medical journal, like you're trying to advance the science. So, yeah, I
yeah,
mean, the tide of history is moving in this direction and it continues to do so.
I think that's definitely true. And in the last 10 to 15 years, we've seen, as you say, open source go from like the fringe nutters, even though it wasn't really, but that's how
No.
we were characterized back in that era. Now,
Yeah.
as you say,
Yeah.
it's much more central. And
Mhm.
but the other thing that's changed is the bigger picture geopolitics around
Mm,
how trustworthy we think other countries might be. And I think
sure.
10 years ago, if you were saying you might not be able to trust American corporations to act in the best interest of their customers if
Mm,
they have a
mm,
conflict of interest
mm,
where the American government has become involved, people would have just laughed at you 10 years ago. They would have said, "Are you
mm.
sure? Because it sounds like something you should be talking to your therapist about rather than us." But now we have got this accelerating madness on the other side of the Atlantic, and countries are really very serious about developing their
Sure.
own digital sovereignty. We've got the
Absolutely.
Germany
Yeah.
stack, where the
Correct.
Germans have very, very clearly signaled an intention to have digital
Absolutely. Yeah.
sovereignty, and I think that will catch on across Europe because
Yep.
we Europe gets on quite well together. Brexit aside, we're still part of Europe, and we will rejoin eventually. I have no doubt. And if nothing else, this last few years has really cemented the need for that, and we will have European sovereign data, sovereign
Yeah.
owned tech stacks.
It's an existential issue for Europe now. The
Yeah,
French and the Germans and the Nordics. It's every conference I've been to lately in the last year around digital in Europe. Digital sovereignty is top of the agenda, and people are talking openly about it, very openly about the risks of not doing anything. So yeah, it's a huge issue now. And
I think it's great
interestingly,
that
I think in
that's
terms of geopolitics, one thing I like to point out to people is if you look at what does US big tech, the European Commission, and the Chinese government have in common? Well, they all promote open source. So, in these divided times, that is the one thing that seems to unite people across the globe.
Yeah, I think it's great to see. Finally, we're making some traction, and it does seem that if you put out something that's open source now, the first question people are going to ask you is not necessarily why did you open source it. Whereas I think 10 years ago they would have asked that question. Whereas now it's much more understood that that's just good business. That's why you do it, because it makes sense to open source things.
Yeah, well, maybe I briefly mention what we're doing here on that point, because effectively since I came in here, we've been pushing on a digital public services strategy, better public services, and to underpin that, we have what's called a build to share model in the Office of Government CIO, where we build it once and we offer it for reuse across the public sector. And into that environment, obviously, I've then simply harness projects that are already ongoing, about 10 of them, that align up with the digital public infrastructure stuff that I mentioned earlier on from the UN to promote, 10 building blocks. And we're effectively using open source in all of those building blocks. And we're
Wow.
trying to offer them back to others as open source as best we can. And I can quickly run through them. I mean, you'll recognize them. These are generic things. You've got digital identity, content
Yeah.
management systems, data collection systems, notification systems, payment systems, information mediator, analytics
Yeah.
engines. We have a digital wallet project, and we're doing work on AI. And we're pretty much all using open source, where there's a leading library, like Whitetail, for instance, we found out about it. The NHS are using Whitetail as a content management system. We now
They
use
are. Yeah.
Whitetail across the board. And so we're thankfully now in a good place around open source here in the Irish government. Now, it's early days internationally still, I would say, in terms of the journey towards open source. But again, you and I have talked about, 21st century healthcare and 21st century government is being transformed by open source digital public infrastructure. That's happening as we speak.
Yeah. I mean, it's great to see finally this happening. And those projects, as you say, they're all the building blocks of everything governmental. They're the kind of things that you're going to need. And if the government provides those things, then other services coming along can use them. So, for example, like we have gov.uk Notify, so notification system.
That's right. Yeah, very similar.
All built on open source stack. And we use that within the project I'm working on now to notify parents that they are going to need to book their children in for vaccination. So if you provide it, it's like providing the railroad tracks, isn't it? Those
Absolutely.
they're the prerequisites, the infrastructural pieces, and then other people can build the trains. But you can't leave it to the market to build the railroad tracks, because you just end up with a whole load of non-conforming, non-interoperable tracks.
Yeah, I think you do need governmental leadership, on this agenda. And I mean, we have an interesting model here. Again, credit to GDS in the UK for some of the building blocks I mentioned. They've been there first, but what we're doing is we've got 3 companies with us in the Irish government who are working with us to develop these building blocks. So we're trying to get a healthy connection between, if you like, the government or the state and the market. But we are making sure that these building blocks are understood as digital public infrastructure. They're built on open source. No one vendor has a proprietary lock on them, and they are working with us based on the service they give rather than the lock they have on their code. And the 3 companies we have are very happy to work that way, and we're getting good deliverables, good services, out and about that way.
I think that's a great model, and we do that in the UK as well. I think we sadly we also do the other model, which is where you pay a massive company like Fujitsu to build a platform like Horizon for the post office, which we've paid for in its entirety, and yet it's owned by Fujitsu, and that causes its own problems in terms of it's expensive and it's got lock-in. But then when there's a problem with it, it turns out you don't even own the code. So during the
Yeah.
procedure of trying to work out what had gone wrong in the Horizon scandal, even in court, some of the code was not allowed to be shared within the court, or was not allowed to be published as part of the discovery
Really?
process.
I didn't know that.
Extraordinary that
Mm,
is the stranglehold they've got. When you would think
mm,
that, it's like if you asked a builder to build you an extension on your house that you own, and the builder builds the extension and then moves into the extension and says, I own this now, or rents it back to you. In the tangible world, we would never stand for that, but it seems completely normal for companies to be
mm.
paid to build government IT, and then it turns out the company owns the government IT. I've never understood
Yeah.
how does that get in your contract?
Yeah, no, I think government needs to be careful about that. I mean, look, it goes without saying that we have relations here with big companies too, but I do think government needs to be careful about that. And it goes back to the digital data sovereignty point we were talking about earlier. Um, but I think they're all waking up to the need to that the market model needs to shift. At least certainly we have discussions with the likes of Microsoft, Google, AWS, etc., the big players about our open source strategy, and I get
Yeah,
it. So, and I make it very clear that when we're building out our technology, we don't want to be dependent on any one of the single cloud providers, for instance. We want to make sure it's a vendor neutral layer, and they get
yeah,
that. But you
and
have to
that's
be
it.
willing
If that
to take a lead on it, I think, and make
that's
sure you're
about
representing the public interest. Yeah.
that, yeah, for government, there's nothing that says you can't use any provider of any size as a
Mhm.
commercial partner to get this stuff done.
Yeah.
But partnership needs to mean something, and there has to be a two-way street. And I think as a government, you need to be a good customer and be very
Mhm.
clear
Right.
that you want this thing to be built and you want it to be built in this way. You don't want to be locked into a single vendor at any point. It's just what
Yeah.
what you've been saying is, so
Mhm.
whereas I think the caricature of open source that people use to try and take it down is that open source means self-hosting everything, never using commercial partners, and is inherently just for hippies and kind of neckbeard sysadmin IT people who've got the time to sort of run everything themselves. And that is what I've said. It's a caricature, it's a lie, it's a myth, because open source is completely understood by even the biggest of all the cloud providers. And if you just say,
Mhm.
we want you to build this thing, we're going to pay you to build it in open source and we will own it, they'll say fine. And all you're doing is
Yeah.
providing the
True.
parameters. You're saying, that's what we
Yeah.
want. Be a good customer.
Indeed. Yeah. That's my experience. Yeah. And the market is shifting that way. So yeah, I agree with you, Marcus. Yeah.
Yeah. What would you say are the differences between the UK and Ireland in terms of sort of government IT? Are there any advantages to being in a smaller country? Any disadvantages?
Yeah, I mean, I think there are. I mean, certainly my experience of working in the NHS and in England was that the size and the scale of it, the population of it's over 50 million, isn't it, in England alone?
Mm,
Makes it difficult to kind of get, I suppose, a network effect. You know, um, you have obviously different regions. You've got the center. The relationships maybe aren't there that would be in a smaller country. I forget where I read it first, but certainly I think the evidence suggests that the smaller countries like the Scandinavians with a population of 5 million, which is a kind of equivalent to a lot of the UK regions of English regions, it
yeah.
make it easier because you again it's about degrees of separation between people involved. So you find it easier to pick up the phone and kind of get issues resolved. So I think our size, smaller size, does make it easier to move at a bit more pace for sure. Now, having said that, that also means that we're small and we can't necessarily act alone. So, we do try, and I think it's Ireland particularly is got quite a global outlook to kind of try to talk to our European and British and US kind of neighbors, basically about the work that we're doing and try to, not be doing it alone. Um, and I see this with bigger countries like the UK and France and Germany, because of sometimes of their size and scale, they think they can go it alone, and
Yeah.
tend to put their heads down and not tend to look outward as much. I think Ireland is a very much a global outlook, so I think that's an advantage, because I think in this day and age, the wicked challenges we all face, you can't solve them on your own. So, I hope Ireland, you know, continues to kind of keep its eyes outward, and I hope that the UK, again, can be become more involved in some of the global partnerships, that
Yeah.
that they would be well placed to be partake in.
Yeah. I've definitely heard um, the figure of about 5 million as being
Mm,
a
yeah.
sweet spot for digital
Mm,
transformation. Um,
yes.
Certainly, some of the devolved nations of the UK do quite well in some areas. Certainly,
Mm,
Wales and Scotland about the 5 million mark, and they seem to
mm,
uh,
mm,
find it possible to make some headway. I think being a smaller country, as you've alluded to, sort of it gets rid of the ego side of things. I think England
mm,
particularly is guilty of having a big ego and thinking that we can do everything for ourselves without needing to be
yeah.
outward looking, without needing to refer to what the other devolved nations have already done, what Europe has already done, and just
Mm,
focusing in and saying, well, we already have the perfect system because it's the NHS, and therefore no one else is worth listening to, and sort of
mm,
very inward focused. And certainly
mm.
when I'm heavily involved in the open EHR community, as I know you were and have been.
Right. Right.
And one of the things that you get to see by being part of that community is how much great work is happening across all of Scandinavia and Western Europe, Eastern Europe, and internationally as well.
Yeah, open air, obviously, a community I was proud to be very involved in for a while. Yeah, exactly. Very international in its orientation, and anybody who hasn't seen the open air clinical knowledge manager and the way that's gets clinical knowledge, reviewed and agreed across the globe, it's a great exemplar. I think you're right. I did sense that when I was in England. Because of the size and scale, maybe people feel they don't have the bandwidth to look outside of England.
Mm.
Um, yeah, I think we're fortunate here that we have to look outside. That works to our advantage, actually.
Yeah, I think it's good to have that inbuilt attitude of like we're not the whole world, so let's just have a look
Yeah,
and see if it's already been done first of all.
correct, correct. Yeah, basically, yeah, yeah.
Yeah. How's the tech scene getting on in Ireland? Because it's a place where 10 years ago it was exploding with tech investment, and Dublin
Mm.
was sort of one of the digital centers of Europe. Is that still the same? I know I had heard it had cooled a little, but is it still a good place to do tech?
Well, it's interesting. I mean, big tech is still a very significant part of the economy here. Very significant part of it. US big tech primarily, and there's pros and cons to that.
Mhm.
It means that Dublin and Ireland is essentially European HQ or EMEA HQ for a lot of these companies. So that's that's
Yeah.
that's no bad thing. That's good for Ireland, if you like, as a country. Um, and obviously that brings jobs and corporation tax, et cetera, which is all has helped this country prosper. But obviously, there's an argument that actually that the size and scale of big tech here, to some extent, inhibits local industry from growing. And I don't think we have enough, Irish, SMEs that are, internationally leading. Yes, now there are more and more of them. Stripe would be one that you'd have heard of, for instance. But we could do with more, I think. And there's definitely an argument in the society as to how we shift to supporting more indigenous industry in the tech sector. I mean, obviously the world in the last few years with COVID and geopolitical tensions means that there's been ups and downs in the industry, to match the local global patterns. And with AI now, again, there's questions about hiring and the direction of the industry. But yeah, I mean, it's a very vibrant tech scene here still, and hard to get good people because they tend to get snapped up by some of the big tech players in the city. So you could say it's still very much thriving, I
It's
think,
still thriving. Well, that's good to hear.
Yeah. Yeah.
Swerving a little bit back to the kind of government and healthcare area, because I've just sort of thought, what one big difference that may exist is, how often does your healthcare system in Ireland have major reorganisations in its structure, which is something that we seem to do in the UK and in England incredibly regularly. I mean, just in the past 5 years, we've had NHSX, NHS Improvement, NHS England, NHS Digital, all have become back into one organisation, and that organisation is going to disappear next year. Endless reorganisation. Is it like that in Ireland?
Well, I don't work directly within the Irish Health Service, so I should caveat that. So I'm just watching it from as being a kind of an observer. I mean, we have, the question is around how do you manage the complexity of healthcare in organizational structural terms? Do you have one central body? Do you have a federal organization of smaller bodies? Do you have a very distributed, approach with a very light center? Historically, there's been a very large organization here called the Health Service Executive, the HSE.
HSE, yeah.
Yeah, and that has had, I have to be careful the language I use here now, but essentially that has had its ups and downs. It is certainly delivered, I guess, in some areas, but it's been criticized in other areas for sure, because of the size and scale and its ability to deliver. So there's been a push towards more devolution to what were and a couple of attempts to do that. Most recently, I think what are called Regional Health Organization, RHOs, about 6 of those, to go back to what was there prior to the central HSE, which were health boards, and again, like your health authorities in England. So again, a shift back to more devolution. And again, that's an early work in progress. Actually, it's too early to say whether that's a success or not. But I think you kind of see this complexity challenge all the time. Where again, people sometimes think that reorganizing the structure will actually will make a difference. Healthcare is complex and not well understood by many people in terms of how do you handle a complex adaptive system that is healthcare. And I think the jury's out as to whether or not there should be less centralization or more federal approaches. We're trying a shift to the more federal distributed approach at the moment, but I'm not sure that that's going to make the difference. I think what needs to be understood at the ground level is how do people organize in teams, to achieve process improvement, from the bottom up with better information and better technology, because real improvement happens from the bottom up rather than from the top down. So you have to facilitate that, and that's an issue I think globally in healthcare. But I don't think, again, that's well understood in the sector, how to get that people, process, and technology alignment to happen at the front line in healthcare, and to scale it up. It's not a well understood science yet. It needs to be better understood.
Yeah, I think I would agree with that. The lesson I think we refuse to learn in the UK and England particularly is that every time you do these disorganizations, as I've heard them being called, is you disrupt the teams. So the very team work at that grassroots level that you're trying to encourage, and you want those teams to feel functional, to feel like an identity, to feel human, and to be practical and productive. And every time you go through a round of voluntary redundancy, or every time you invent a new organization and some people go to the new one and other people are left behind, and then you dissolve the new organization, all of this undermines teamwork. And it means nobody knows who anybody is, that everybody's a new face, the processes get confused at the very least. The politest way of putting it is that they get confused. Nobody knows how to action anything, and the overall efficiency goes down. And I think I wouldn't be surprised if 90% of the work that's done in the English NHS is just feeding the beast. It's internal friction. It's work to overcome internal boundaries and internal barriers to getting work done. It's not actually the end work that's being done. It's just generating friction inside the machine,
It's difficult. I mean, my family are very much medical background. Both my parents were doctors and my grandfathers were both doctors, GPs. And if you look back at the history of healthcare, which was really a kind of a lone clinician apprenticeship model, basically looking after their patients, and then hospitals came along. And hospitals are relatively recent, if you like, in terms of organizational structures and methods. They're not been around for millennia or anything like that. But what you have is effectively a team sport in a building, if you like, trying to But it's difficult because there's you've probably heard the expression, a band of tribes. There's often a tribal element within a hospital of different people because again. Hospital is arguably one of the most complex organizational units humans have ever invented. I mean, if you look at the activity that goes on inside a hospital. So there's lots of reasons why it's difficult to deliver sophisticated, complex, 21st century healthcare in the modern world because everything has just gotten so layered in terms of complexity. I do think, there's a way through it in terms of, again, common understanding of the people issues and the process issues and the technical issues. But you need to be willing to look into the patterns. And I studied medicine as you did. I studied management science. I studied information technology science, and you need a shared understanding of these issues from not just the clinical perspective. You need it from the management perspective and the informatics perspective to actually address some of the challenges that are real there. I've talked about you and I have talked about information in the dark ages. I think people will look back, now at saying that the understanding of this science is still relatively immature, and that's why you're seeing so many problems in healthcare today. Because how many of us, like you and I, have crossed the boundaries from clinical into a management role and technical? Very few. There's still silos. Different people come together, put them in a room. They don't speak the same language. They don't have the same shared understanding of the challenge. They get stuck very easily. There are real issues there that are going to take some time to work through.
Yeah, it's still a relatively uncommon path to go through all the rigmarole of becoming medically qualified and then develop other skills alongside that. In our case, we've moved completely outside of medicine, but you don't have to do that in order to have those additional competencies. And I like you're saying, I think it may become something that more clinicians need to have as we start to evolve into that role that you're talking about. It's not a lone clinician in a clinic anymore. You have to be able to be the leader of a team.
No, that's right. There's a really good book called The Future of the Professions I read probably about 10 years ago, which talks about it, where many of the professions are going to go. It's worth a read. I mean, you and I was drawn, I'll say myself anyway, I was drawn into informatics from emergency medicine because as clinically intense as emergency medicine is, I mean, it's hard to argue the clinical intensity of it. It's an information intensive business or field. It's, and as is primary care, as are most fields of medicine. It's an information intensive endeavor, and most medics don't see it that way. They don't see it as an information intensive sector. But if you look at the way the world is changing now in terms of AI, there's just a wave of disruption that's going to come, because actually if you reduce a lot of the, as you say, the friction within the healthcare environment, a lot of it is about the management, the processing, decision making around information, and AI is just going to knock over a lot of skittles there, to try to change things. So the medical profession needs to wake up. I've been
Yeah,
saying for some time to that, but there are issues within our own profession that don't. I think that kind of to some extent have held back that understanding. But that avalanche from digital to AI is
it's
building all
going
the
to
time,
disrupt
isn't
a
it?
lot of things, and we have to lead it in order to make sure that the safety of the profession,
Absolutely.
the
Yeah.
safety of patients is paramount, and
Absolutely.
brought
Yeah.
with us,
Mm,
um,
mm,
and it
mm,
presents a lot of opportunities. I've seen so many young doctors now feeling frustrated with the software systems they're presented with,
mm,
who
mm, mm,
are
mm,
now given an opportunity to learn much more readily about information technology and to develop a career in it and start hacking on their own projects. And even though those hacking things are not production ready, the very fact of hacking on stuff is the proof of your creativity, and it's your curiosity, and you start learning more, and eventually you find a project that you really can fly with and you can really turn into reality. And it takes a while, but it's really encouraging to see that happening. um, to finish
mm.
off then, what do you see as exciting things that government IT will be doing? What are the next few years going to look like, or what do you look forward to?
Well, it's a good question, and I as much as I'm a digital advocate and the need for change, I do think there are key questions to ask about what we're trying to achieve, if you like, in terms of 21st century society, 21st century economy, 21st century healthcare, and sometimes I'm concerned that we're just kind of on a hamster wheel and we're just trying to do things faster and faster, but not necessarily better or improving people's lives. I think if we get this wrong, which we could do, again, people just get, busier and more burned out, and more people get seen and treated, etc. But not necessarily happy, or their well-being isn't improved, or the well-being of the people, the well-being of the planet, donut economics, if we can throw that in there, kind of
Yeah,
stuff, doesn't get addressed. But if we get it right, then effectively the transformation will allow people to you know uh, really improve the transformation really improve the process of health and other public service delivery with much better tools that will actually free up people from being busy to being productive, and actually, for instance, in healthcare, allow more time for bedside manner chats, because you're not so busy writing up the paper notes, and you end up giving people time back in their lives, not just the people, but the professionals, to have, a better quality of life and a better quality of service, as much as a better service, if you like. I think that potential is there, but, you know, we have to seek that out. Because I think one of the things I think lessons from COVID is that, if you remember the major shift in the way the world operated for those few weeks or months, people
mm,
were talking about grand reset, in terms of the way things are done differently,
yeah,
which isn't necessarily doing more of everything, consuming more, doing more, etc., but doing a small number of things better with a better quality about them.
yeah.
And I hope that what we shift to is improving people's lives with better services, but giving people time back to to have a better quality about the service as much as anything else. So I think all of those possibilities are there if we can work together to actually deliver on the digital public infrastructure, the digital public services, etc., that are needed in healthcare and other settings in this century. I mean, the work needs to be done. It's just how we go about doing it is the question.
Yeah, so a really good way to finish, and that is what I hope for as well. That it's we can make things better, but we have to make sure that that's what happens. It doesn't just happen on its own. We've got to actually
No,
drive that process, and have leaders who can see the difference between a good way of doing something and the bad way of doing something, and advocate for the better. Um,
that's right. That's right. Yeah, leadership is important, for sure. And medics, and medics are particularly well placed play a really vital role in the leadership of this well-being, if you like, agenda, for everybody as we move into the, move into the, the 21st century, and with all the challenges that are in front of us.
Hugely so, yeah. Well, Tony, it's been a real pleasure talking to you. I love the way that you have always really analysed all of these, everything from, the detail of how something is done, right up to the geopolitical angles and the climate change effect. And, you mentioned donut economics and stuff.
Right.
And so like the way you've been thinking about these things, it has massively influenced the way I think about stuff over the years, because we've been working together on the same sort of things and sort of in the same little pond of open source advocates. So thank you so much for being on the show. Best of luck with the digital transformation of the Government of Ireland, and thank you for everything you've brought to us today.
Oh, thank you, Marcus, for the opportunity to be here. It's great to catch up and chat, and good luck to you and your listeners. And thanks very much for the opportunity again. Thank you.
Cheers, Tanner.